Behavioral health is a wonderful opportunity to partner amongst one another, but also with partners in the community.
Just sort of writing checks is sometimes the easy thing to do, but I'm not sure it's going to get us the outcomes that we really wanted.
The people on the front lines who give care and those who get care, they are best positioned to understand the problems and solutions that work.
I strongly believe that healthcare is local, and it's really important that we continue to provide healthcare that is local.
And we have been able to invest over $1.5 million back into our people to make sure that they're paid adequately for the work that they're doing. And this would not have happened if it weren't for our system alignment.
For the first time in a long time, we are taking the issue of health equity and giving it the focus that it always should have had and deserves to have as we move forward.
Well, let's think of it as the 3 S's. We need to stabilize our financial situation, we need to strengthen our workforce, and we need to secure our ability to continue to serve our communities.
Workforce is a fascinating issue. There's so many aspects to it that are really important to bring voice to. First and foremost, obviously, the workforce shortage does create and exacerbate the financial challenges the hospitals are in.
What does value-based care mean? How do you define accountable care, for example? Does it mean more time with your physician? Does it mean a different care experience?
When I ask all of you what keeps you up at night, even though there are many things that make us toss and turn at night, our financial future is probably at the top of that list.
People think price transparency and they think it's like going to a fast food place and saying, okay, I want a number 3 and I want to supersize that and that's not how healthcare works, right? And so we have to be out in front of this all the time, sharing our story.
The reason that we went into losses so fast is because the inflation hit us so fast. You know, in that early part of 21, with the labor just exploding, one of the quotes that I've always said is, you know, we had no choice but to keep the door open.
You know, to be listed alongside the previous Service Award honorees is humbling, and that makes this award just very, very special. What also makes this award special is that it comes from an organization for which I have the highest regard. My association with the AHA spans my entire 42 years in healthcare, and I am the better for it, no doubt.
Everything we do really comes through our mission and vision, our mission of improving health, our vision of creating healthier communities now and for generations to come.
I think the question becomes, do we have the capacity to actually deliver on the promise that we're making to veterans? And that's overwhelmingly what I'm focused on.
It's very clear to me, and I don't say this just because I'm here, it's very clear to me that the leadership of America's hospitals has literally saved tens, if not hundreds of thousands of lives.
All of us share that honor, the privilege of leading teams who care for their neighbors, who care for their loved ones and strangers every hour of every day.
I know we have no shortages of challenges facing our field right now, but with your leadership, your commitment, and your passion to meeting the needs of your communities, it makes me confident about our future. Thank you for attending this annual meeting, and thank you for the work that you do every day, day in and day out, in serving your patients. This session is adjourned.